Senator Coburn, Senator Brownback, Senator Thune, Senator Murkowski, who will be here shortly.
Without objection, sir.
Thank you, Mr. President. Mr. President, health care reform is the agenda for the nation, and it ought to be. We on the Republican side want health care reform. But we want the right kind of health care reform. Our focus is on costs. Our focus is on the cost to each American as he or she buys their health care policy. Our focus is on the cost of the government of the United States, which each American has a responsibility to pay for. And what we have to do is to reduce costs, to make it easier for Americans to afford their health care and to afford their government. Every single one of us knows that unless we reduce the cost of the increase in health care, that we won't be able to pay our bills in Washington, D.C. We're in the midst of appropriations bills. And there's well-meaning debate here about whether we should spend more money for national parks and for safe drinking water and other needs, urgent needs that we have. That's the bill that we're talking about today, clean air. Well, we should spend money on those urgent needs. Americans want us to do that. But we can't have those dollars, as the senator from Alabama pointed out yesterday, if we continue to increase the debt, trillions in debt, and run up the interest rate bill. We're headed toward a situation where by the end of this decade, we'll be spending $800 billion a year on debt, more than we spend on national defense, 8 times as much as we spend from Washington on education this year. So those dollars could either be in the pockets of the American people for them to spend for themselves, or we could be spending those dollars to clean the air, to relieve traffic congestion, to provide Pell Grants and student loans so Americans can go back to school. Those are what the government ought to be spending money for, not on increasing debt. So the health care reform is first about costs, the costs to Americans of their own health care policies and the cost of their debt. The president noticed this the other night. He said in his remarks to us and to the American people that the health care bill couldn't add one dime to the deficit. That's reassuring because the president's proposals are already adding $9 trillion to the deficit over the next 10 years. He's doubling or tripling the national debt, which means he's adding more to the debt by a factor of 2 and then 3 than all the other presidents put together. So surely we don't want to add more to it with a health care reform bill. But when the president said that, he completely wiped out all of the Democratic health care bills that have been proposed so far from the House and from the Senate. The Senate Health Committee, the several bills in the House, the Congressional Budget Office has said they all add to the debt in the first 10 years and in the years after that, so they should be off the table according to the president's own standards. And so now we're looking at the Finance Committee in the Senate and to see what they can do. Senator Baucus, the senator of Montana, has worked very hard in a good faith bipartisan way to try to develop a bipartisan bill, a comprehensive bill. But as we read the bill, there are a great many things to be worried about. For example, if you don't buy a health care plan, the IRS will tax you. Now, the president and George Stephanopoulos on a Sunday show, and Senator Graham said the president seemed to be on every Sunday show except the Food Channel, we're talking about the definition of tax. But that's the first thing. And second is the Medicare cuts. I see the senator from Arizona has come, and I would say to the senator through the chair that we've received permission from the chair to engage in a colloquy between you and other Republican senators who might come. I've already pointed out that the president himself has disqualified all the plans that our committee worked on, the Health Committee, and that were in the House because they all add to the debt. Now we see the Baucus plan coming forward, and I wonder if the senator from Arizona has had an opportunity to look at, of course, that's not a bill yet. We all understand that. It's just concepts. and we'll want to make sure we have time to read the bill and to know what it costs. But I wonder if the senator from Arizona has had an opportunity yet to form an opinion about whether the Baucus bill does what we hope, which is reduce the cost to the American people of what their insurance costs and reduce the cost to the American people of their government in Washington.
Well, I thank my colleague from Tennessee and the great work that he has been doing. First of all, I would ask my friend if he had the same experience that I've had at town hall meetings, that one of the hand-done, not printed out signs, but one of the hand-done signs is, have you read the bill? And one of the first questions at the town hall meeting, have you read the bill? And of course, that is an impossibility for anyone to read the bill because there is no bill before the Finance Committee. It's my understanding. I understand it's about 200 pages of a, quote, framework. And I think the senator from Tennessee and I are very keenly aware that many times there is a comma, a word inserted here, a word taken out there, which changes the entire legislative impact. You know, the American people are a lot smarter than we give them credit for. They know that in the middle of the night, many times legislation is written and turned into the kind of legislation that, frankly, unless you go through it page by page, word by word, that you really don't know the final impact. So the first point I'd like to make to my friend from Tennessee is that apparently the Finance Committee is working to turn out a legislative package that's not in legislative form. So I'm curious how the members would really understand what's in it. And I guess the second point is that there is still no serious consideration of a couple of the fundamentals: medical malpractice or medical liability reform, or obviously the ability to go across state lines to purchase insurance, and allowing small businesses to pool their assets so that they can compete for health insurance policies that large corporations are able to. So and the other question I would ask, because I know that my friend from Tennessee has had many roles in his long political life, as the senator from Tennessee had, as a former governor, had any contact with the governors and their organizations as to how much additional costs would be laid on those states which are in dire shape, certainly mine is, in the form of additional Medicaid costs? I noticed that the majority leader at first complained about the bill and the costs that it might accrue to his state of Nevada, but I guess that has been fixed to his satisfaction. But I don't think that the other states, a state like mine that's still looking at over $1 billion deficit, can probably would be eager to absorb dramatically increased Medicaid costs. I wonder if my friend, former governor, former cabinet member, former candidate for president, former former many important roles in American life would respond to that.
One of my friends said to me after I was governor, "Rooster today, feather duster tomorrow," and I'm afraid I'm in the feather duster category. But the senator has made a terrific point. I want to go to the senator from Oklahoma who's just arrived to talk about this, one of the physicians in the Senate. But on the first point, we need to read the bill, and there's no bill. And Republicans yesterday tried to get the Finance Committee to say once there is a bill, that at least for 72 hours, it'd be on the internet. And then we need to know what it costs, because even as the president says, it can't add to the deficit.
We're on the internet for 72 hours. Americans, maybe as many millions of Americans as wanted to, would be able to read the bill themselves.
Could let us know what they think of it, and then we need to know what it costs. And as to Medicaid, every governor in America is worried about this. The Democratic governors and the Republican governors have said to us, if you want to expand the Medicaid program, which the states pay 40% of, you pay for it, because we can't raise state taxes or raise tuitions or cut the highway program to do that. I wonder, the senator from Oklahoma heard Senator McCain's question. The senator from Oklahoma and Senator Barrasso the senator from Oklahoma has delivered thousands of babies. The senator from Wyoming is an orthopedic surgeon. They've been touring the country in connection, listening to lots of doctors and physicians and medical personnel. I wonder if you have a reaction, Senator Coburn, to Senator McCain's questions.
Well, first of all, let me say my biggest concern for my patients in this whole debate is, will the American consumer still have the power and the ability to select who is going to give them this most personal of all care when this is over? And the answer to that is no. It's not no for everybody, but it's a no for half of the American public. That's what it means.
Would it be no for the individual who has employer-based health care and that employer then opts for the so-called public option, which would be a government-run health program? Could then that employee see the same doctor?
Well, we don't know, but most likely half of them won't. You know, the whole debate ought to be, how do we get more value out of the healthcare system that we have today, rather than how do we add more money to the cost of healthcare to cover more people? The reason my patients have trouble getting care is cost. Right now they have choice except if they're in Medicaid, and they have some choice if they're in Medicare, because we're seeing a larger and larger percentage of doctors who cannot afford to take the Medicare reimbursements. But can they afford the care? This bill does nothing to lower health care costs. It does nothing to lower health care costs.
Isn't it true, in fact, that the Congressional Budget Office has said that these increased costs, at least half of them, will be passed on to the individual?
I would say to the senator from Arizona, that's exactly right. The Congressional Budget Office did an analysis of the impact of Senator Baucus's plan on insurance premiums, and it showed the premiums for those in the individual market would go up. So to the senator from Oklahoma's point, one of the effects of the one remaining bill that's being considered here at a time when we're trying to reduce the cost to Americans of their policies and their government is that premiums will go up.
Premiums will.
Very important question. There's no one who has led the fight against waste, fraud, and abuse more than Dr. Coburn. Dr. Coburn, the president keeps saying that we will eliminate all this fraud and abuse and waste. If we can, why don't we start tomorrow?
Well, I agree, and we've offered for years a couple of ways to do that. I think it's important for the American people to know how much there is. The Department of Health and Human Services estimated in 2007, that's the last year that they have numbers for, that $62 billion was improperly paid out of Medicare. The GAO, when they looked at that report, said, no, you're way off. It's at least $85 billion, and we think it's higher. Well, if you look at that, that's almost 20%. 20 cents out of every dollar that Medicare pays out is lost to fraud. Why wouldn't we fix that first, rather than say, if we fix it, we're going to take it from Medicare and put it somewhere else, when the trust fund, the HI trust fund, the hospital insurance fund, is going to be belly up in 2017. And
Coburn, isn't it true that under the Baucus plan, about half of it would be paid for by Medicare cuts, which would then be spent on a new program?
That's right. And Medicare is already unsustainable. So what's going to happen? And there's another factor in there, is we have it fixed that with this bill, there won't be a big cut to the payments to doctors under Medicare. But the years that follow that, there'll be a 25% cut. Now, if access is a problem for Medicare patients today, it's going to get worse. It's part of the lack of truth in this bill, is they don't address what we have set in motion to take dollars away from the healthcare industry.
I ask Dr. Coburn again, if we start tomorrow, what can we do?
What can we do? The first thing you do is put undercover patients in the Medicare system. And you put people in jail who are defrauding Medicare. You know, if 30 or 40 doctors went to jail in the next 6 months in this country, you'd lower Medicare costs by 10%. because all of a sudden they'd start thinking about, I can't skirt this. I can't play this game. I can't do it. The risk is too high. Matter of fact, here's one of the things we know, that in Florida, the drug dealers have switched from being drug dealers to Medicare suppliers because they can make more money defrauding the federal government. It's harder to get caught, and the penalties when you are caught are less than if you're dealing drugs. And so consequently, we have all these people in the business of defrauding Medicare. And there hasn't been a plan that has been effective in cutting Medicare fraud because nobody knows, and the government's all about Medicare. So it is designed, by its very design, is designed to be defrauded. We should make structural changes so that it's not. And with that, get better care and lower cost care, like paying for outcomes rather than paying the American Medical Association to use their CPT code.
The senator from South Dakota and Kansas have joined us, and Senator McCain is leading a colloquy on the Baucus bill and health care. And I wonder, Senator Thune, if you see the Baucus bill as a bill that is, or it's not a bill yet, it's likely to reduce costs.
I think that's the big question about all of these various pieces of legislation that we've had in front of us is what do they do to reduce costs? Even the Congressional Budget Office has said repeatedly that in this bill in particular, the Baucus bill, the most recent version of a health care reform proposal here, is a $1.7 trillion cost over 10 years when fully implemented. And that if you actually look at what it does for most people in this country, they're going to see their health care costs not go down but go up. The premiums are actually going to increase. And the reason for that is that many of the taxes imposed in the bill to help pay for the cost of the $1.7 trillion expansion are going to get passed on. And so the people who get hurt by this are hardworking Americans who are expecting that if Congress is actually reforming health care, that would mean that health care costs, that the cost that people pay for premiums for their health care coverage would actually go down. The Congressional Budget Office, under questions that were raised yesterday by some of our colleagues, responded that dollar for dollar, that those taxes that would be imposed to pay for this would actually be passed on, and that you would see higher health care costs. And so there hasn't been anything in this entire debate yet, or any of the bills that have been put before various committees or that eventually we assume will be considered on the floor here in the Senate and the House of Representatives, that have actually impacted costs in a way that they go down, that it reduces the overall cost for people in this country. And furthermore, and I've talked about this, and the senator from Tennessee, we had this discussion on the floor yesterday, is that many Americans, those that I heard from in my state of South Dakota during the month of August and in any conversation that I have out there, are very concerned. And they're concerned really about two issues. One is control, one is cost. Who's going to control their health care? Is the federal government going to do it? Is it a bureaucrat in Washington, D.C.? Are we ceding more and more, in this case 1/6 of our economy, more and more control to people in Washington, D.C.? And the Baucus bill, in as much as it doesn't, at least at this moment, contain the, quote, government plan, still assumes a high level of government involvement, government intervention. Government would determine which health care plans would have to approve, which ones would meet the standards that the government set. And so you've got a high level of government intervention with this plan, as you have had with all the other plans, but perhaps even more importantly, and this is the issue that I think most Americans are really homing in on, and that is the cost. What is the cost to me as a taxpayer? In this case, $1.7 trillion over a 10-year period when fully implemented, and does it reduce my cost of health care? So they're going to look at it two different ways. One is, what am I going to have to pay in the form of higher taxes to finance this? And secondly, how is it going to impact the cost of health care for me in terms of the premiums that I pay? And I think it's fair to say that based on, and this is not what we're saying, it's what the Congressional Budget Office has determined, that actually the cost of health care for a lot of Americans under this proposal, and the Baucus proposal, is going to go up.
Senator Thune, I see the senator from Kansas is here. I wonder if Senator Brownback of Kansas or you in South Dakota have been hearing from your constituents about the possibility of shifting costs from Washington to the states. because we in Washington say it's a great idea to expand Medicaid, and then we shift some of the cost of that to the state taxes go up or state services go down. I wonder if you've heard anything from the people of Kansas about that, Senator Brownback.
Well, I certainly have, and I appreciate the senator from Tennessee leading this discussion and also asking that question as a former governor. He's dealt with these issues, and he knows that when Washington dictates something, or too often, Washington will dangle a little bit of money out here and say, okay, we would like for the states to do this, and here's a little money to get it started, and then 3 years in the program, 5 years in the program, money's pulled away at the federal level, and the state is left with trying to fund this. It's on two levels that I get it at the state level. Number one is trying to drive so many more people into Medicaid. And that's by raising the amount of coverage of people in Medicaid that it then gets a big price tag with it at the federal level initially and at the state level as well. And state budgets are really strapped right now. I was just talking with some state legislators yesterday and are looking at a multiple hundreds of millions of dollar hole next year. That alone without adding additional Medicaid requirements from the federal government on top of that. And that's clearly a huge problem for them, that you're going to add a cost at a time when they don't have the funds. Now, the federal government is much of it saying, well, we're going to pay for it initially. And the proposals under Baucus are to pay for most of it initially. But I don't think there's any question but that then over time, the state's going to have to assume a bigger role of that, and that's going to be up to state responsibility. But there's a
Governors Association chairman of Vermont said that all Democratic governors, as well as all Republican governors, said, don't shift it to us. If you want to expand Medicaid from Washington, pay for it from Washington.
Pay for it and pay for it completely. But there's also a more pernicious piece of this, and that is that we've got 40% of our physicians in Kansas are saying they're not taking more Medicaid patients. That's 40% now. And now you're talking about expanding Medicaid, the number of people in Medicaid, when 40% of your doctors are saying, we aren't taking them, and you're saying, well, why won't the doctors take it? And it's not that they don't want to have Medicaid patients, but it's these reimbursement ratios that they get. And listen to these numbers from MedPAC are saying that Medicare provider reimbursement rates are about 80% of private insurance. So private insurance, and then 80% of that is Medicare, and then Medicaid is 72% of Medicare. So you're cutting it even back further to the point that physicians are saying, I just can't afford to take more Medicaid.
Medicaid is the largest government program we have today, bigger than Medicaid. It has low-income Americans in every state, and the Baucus proposal, I believe, plans to add about 15 more low-income Americans to this plan that 40% of doctors won't see patients for.
Won't see them. And so now what you're doing is you're driving people into a system that's a very low reimbursement system that physicians are almost half saying, we won't take anymore. So my concern here is that you're going to drive people into a system where they're not going to be able to get health care. That they're not going to be able to get health care at all because of these reimbursement rates, because of the reimbursement rates that the physicians are having under Medicaid. So I think that's a really deadly piece of this overall proposal. It's the cost on the state, and then it's also that you're driving people into an area where providers are fleeing and heading out of.
I wonder, Senator Thune, I think we have a couple of minutes left at this point. We have 5 minutes left. Well, good. We'll go to Senator Thune, then let Senator Brownback maybe wrap up our time. But Medicare cuts, I mean, those are scary words to most Americans. And some people say, well, you Republicans are just trying to scare the seniors of America when you say the word Medicare cuts. But isn't it a fact that the Baucus plan would cut Medicare by about $500 billion and use it for a different program instead of shoring up the Medicare program?
We know for a fact that the Medicare trustees have said that the Medicare program is destined to be bankrupt in the year 2017. So Medicare is already on an unsustainable path. It needs to be shored up, and what we're talking about doing is getting savings, if you want to call them that, or cuts, I would say, out of Medicare to create a whole new entitlement program here in Washington instead of fixing and making more sustainable a Medicare program that, as I said, is destined for bankruptcy by the year 2017. And I think most seniors and most providers around the country are going to be very concerned about the idea of having their cuts to the Medicare program, $500 billion, as the senator from Tennessee has mentioned, go toward paying for this new entitlement program, which, as I said earlier, over a 10-year period is going to cost $1.7 trillion. So you've got, I think, you not only are going to have, as you've mentioned, a lot of providers who are very concerned about cuts. I think you're going to have an awful lot of seniors who are concerned about how their Medicare benefits are going to be impacted by this proposal. And I would add what you've already talked about, and I know the senator from Tennessee, his governor has called some of these Medicaid expansions the mother of all unfunded mandates. My governor in my state of South Dakota, I've had numerous conversations with him about this. It would cost our state about $45 million a year new revenues that they would have to raise just to meet the matching requirements under this expansion of Medicaid. And in my state of South Dakota, that's real money. I know that doesn't sound like a lot out here in Washington, D.C., but that really adds up. And so he's very concerned, as are all governors, about the impacts, not just on federal budgets, but on state budgets. And of course, as the senator from Tennessee and the senator from Kansas have pointed out, Medicare, and I might add, I love the quote that the CEO at Mayo, which the senator from Tennessee has mentioned, if a public plan looks like Medicare, I think the country would go broke almost overnight, because Medicare is already proposed to go broke by 2015 to 2017. And I think that's the problem that we run into when we try and build upon a foundation that is already crumbling. And the Medicare program is destined to go bankrupt. And we're talking about adding a whole new entitlement. And instead of trying to figure out how to plow some savings back in to Medicare and make it sustainable, we're actually adding to and building upon a foundation that is already crumbling.
We have about a minute and a half left in our time. I wonder, Senator Brownback, if you want to conclude our...
Well, I think just to put it in Kansas-type terms, if you're talking about taking savings from Medicare to start a whole new health care entitlement program, that's like writing a big fat check on a completely overdrawn bank account to buy a new car. You're going, now, well, who would do something like that? When you're saying, well, that's what the federal government is looking at doing in this proposal that Senator Baucus has put forward. Medicare is not sustainable. It is not fiscally sound. You're going to write an overdrafted check on that to start a whole new program that you don't have the wherewithal to do, that most Americans don't want to see you do, because they want to see you fix the current program and get it on a sustainable basis. So it really doesn't make sense. It's out of the stream of thought of the American public. We really ought to back up, stop, and go at this on incremental changes to get costs down and more people covered, that don't drive costs up, that don't do a big federal takeover of the system.
Well, I thank Senator Thune, Senator Brownback. Of course, we believe that instead of a 1,000-page bill, we should do just what Senator Brownback has said. We should go step by step to re-earn the trust of the American people. And we, for example, small business plans permitting them to pool their resources to offer more insurance to 1 million people, buying insurance across state lines, stopping runaway junk lawsuits against doctors, signing up those people already eligible, encouraging technology. All of these are steps we could agree on and reduce costs without running trillions of dollars of new debt, more taxes, and Medicare cuts. I thank the senators from South Dakota and Kansas for participating in our colloquy, and I yield the floor.
The Republican leader.
Mr. President, over the past several